Next two speakers are organizing and implementing a program to address many of the concerns you brought up with the goal of improving the long-term outcomes for the youth in the community. So let's introduce them as a team. Our first speaker, Dr. Brenda Huber. Dr. Huber was awarded a grant 2 years ago to survey services in the community and develop a plan to monitor and effectively utilize those services so that every youth in Bloomingdale Township has timely access to appropriate treatment based on the progress and findings of the first year's work. The board awarded an additional grant to Dr. Huber and a second grant to implement and expand what was learned during the first year. Dr. Huber is the organizer for the Youth Network and has been meeting weekly with area providers to understand our community and its needs. She's a psychologist who organized in Livingston County, Illinois, a community-wide program for young people, and that is what the Bloomingdale Township Youth Network is modeled after. Our second speaker, Shannon Hartnett, is implementing what has been learned over the first year of the grant and working to implement it in a manner that reaches every area of the community in a sustainable manner so our youth will reap long-term the benefits of this research. Shannon Hartnett is the Executive Director of the Northeast DuPage Youth and Family Services, NEDFYS, and this group receives a grant from the 708 board to provide social workers to the Bloomingdale and Glendale Heights police departments. She is also the chair of neighboring Milton Township's newly formed mental health board, a graduate of Loyola University with an MA in criminal justice. She was recognized in 2020 by the West Suburban Philanthropic Network as a finalist for Nonprofit Executive of the Year. And in her spare time, but Shannon, do you really have She's volleyball coach at the Wheaton Park District. Her agency has participated in the weekly meetings and is ready to do the hard work to make the Youth Network a success. So, Dr. Huber, let's start with you. You've been holding weekly calls for over a year now. What have you learned about our community, and how will you know our new Youth Network is working? And then, of course, we will talk with Shannon, who will implement what you've learned. So, how will we know it's working? What have you learned, and how will we know it's working?
I just want to say, let me take this up. Listening to Dawn talk about everything that the providers have been dealing with over the last 2 years. I mean, basically, we've been meeting since the start of the pandemic. And it's just been such a privilege to be with everybody who's in the trenches every week doing this, right? I mean, it's been, I guess, intense is the word that is coming to my mind. And the meetings have not only been helping us understand what's going on, what the needs are, and what kind of resources we have in the community, but it's been us supporting each other too, because Dawn's not the only one, right? Seeing all that, but every one of the providers has been dealing with their own process during the pandemic, but then also serving the people that we care about. The main thing that I've learned is that this community is amazing, and there are tons of services. There are a lot of resources in Bloomingdale Township, and what we've discovered is that they are not equitably accessed. So it might be that you're a family that everybody thinks you should be able to access whatever you want, but there's a stigma about reaching out for mental health services. It might be that your cultural background is such that the idea of getting mental health treatment is shameful. There's a stigma about it, and so youth from those communities may even want to get services, but they're youth, right? So they have to rely on their families to access it. Then we have all kinds of groups of individuals who experience poverty and all the barriers that come with that. So the transportation, I know the board has tried to address transportation issues, childcare, taking time off work, all those kinds of things. One of the pluses of the pandemic was that so much was available online, and that did allow a number of families to get services that wouldn't have been able, to take off time from work and all those kinds of things to travel. But those barriers keep the access to the services unequitable. The other thing is it might affect where you're born in the township. Like there are some services available to some communities and families. It might depend on where you go to school. Different schools have different community agencies integrated and working. Dawn's services are only available in certain schools. And then we discovered that there was a lot of lack of awareness of what was all available, even amongst ourselves. That was one of the biggest gains early on in meeting, was to find out, oh my gosh, I didn't know that you all did that over there, or this is available, and being able to refer to each other. And then there are families that don't meet whatever the eligibility criteria is for this or that service, right? Now, Dawn's services and some of the services in the community are funded by the Bloomingdale Township Board, and so anybody in Bloomingdale can get them, right? But that's not the case on a lot of the services that are available. So that was the first thing that we learned, was that there's a lot here. We have so many blessings in the township, and yet not everybody has access to all those things. And then we realized that if everybody who needed mental health services actually showed up and accessed them, we would not be able to handle it. We don't have enough resources if everybody who needed them actually was able to access them. So that led us to realizing we needed to approach children's mental health a little bit differently through a public health model. So in a public health model, the way I like to describe it is it's just a continuum of supports where everybody gets the supports that are as intense or frequent as they need them. So there's a whole level of support that is all about just promoting well-being, preventing problems from occurring. And that is so much the big bang for the buck, right? Is to actually prevent problems from developing. So one of the things that we've done in the community is just simply to create a resource guide that shows what are all of what we're calling tier 1 interventions that community agencies can provide free to any school. So the schools in Bloomingdale Township have received this community resource guide that says, hey, if you want substance abuse prevention stuff in your classroom, here's how you get it. If you want, relationship skill development class, here's how you can get that. So all the things that are free and available to the schools are all in one resource guide, so it's super easy for the schools to be able to pick and choose like a menu. Another thing that we've been looking at is there are these collaborations for 0 to 8-year-olds within the township. And as it's turned out, there are certain areas of the township that don't have a 0 to 8 collaboration. And so we're talking with those communities because the children born in those particular communities may or may not have access to all the different levels of support that are available just across the street in another school district. So those are some ideas that we've been pursuing to promote well-being, the social and emotional well-being of children. And then a whole wave of just how do we know when a child's getting off track? How do we find out if kids are not developing the mental well-being that we're hoping for? And so we're looking at trying to screen children everywhere possible, hopefully every kid every year, and then intervene early, right away. So what typically happens is kids get evaluated, and if they're not bad enough off, then they can't get help. And so we're looking at ways to provide supports right where children are. So integrating these supports in schools and other places where children exist, like childcare settings and so on, so that we identify children that are not doing well. We intervene right away. Again, very big bang for your buck, right? To keep kids from suffering and developing problems. And then the last one is, I think will be a good lead-in to Shannon's talk, is making sure that everybody knows what's available for them. So we're working on another resource guide that will go out for just free stuff, how schools can get access to therapy, crisis services, care coordination for the kids that have already developed problems, right? Looking at referral GPS and some of the Chris DuPage and the IRIS system is launched out of the health department to help make sure that when a family is identified as having a need, that they actually get to somebody who can pick them up and meet their needs, and they don't get lost in a crack, right? And then for families that have children who already have an identified need, maybe they're experiencing depression, maybe they're engaging in some substance use, they're having thoughts of suicide, whatever those issues might be, that we have care coordination. So we make sure that not only are they getting therapy, but that family is getting almost like wrapped around with all the things that they need until they can get back on their feet. And so care coordination, we've got one whole subgroup just looking on how to help children that already have a mental health condition, and especially their families, because the child is not in isolation. They are every day in the context of their families, and helping the family can help them enormously. What you can do in an hour a week is small in comparison to what a family can do if they're all able to implement the new skills that they're learning. So that's what I learned in working with the Bloomingdale Township providers. The second question you asked me was, how are we going to know if it's getting better? And I got to be completely honest, like, we don't have enough money to do like an evaluation. So some of the ways that this group, obviously this group can tell you if things are getting better, but in terms of how can we know whether our efforts as a whole are working, we're looking at sort of the upstream work with the screening. So each entity that is providing screening is looking at their numbers. Are they able to expand the number of screenings that they're doing? And then over time, as we expand the number of screenings that intervene, we should see the number of what are positive screens reduce. So a positive screen means we found a problem. And so we hope that those numbers of positive screens will turn a corner. Now that's not going to happen in 1 year, especially not at, on the heels of the pandemic. But the idea is that we're going to try to keep a pulse on every child's development, and over time, by intervening early, we'll have fewer and fewer children in that sort of deep end, right, where there are lots of problems that have been developed. And then for the children that are getting these higher end services like the care coordination and so on, we're looking at the outcomes for those families, whether or not those children that are getting actual treatment are getting better. So an upstream and a downstream metric that we're watching. Thank you, Dr. Huber.
So Shannon, you're going to be implementing these ideas and turning them into a sustainable reality.
Before we go to that, could I ask this lady something?
Sure.
So, it seems to me that this anxiety, depression, all these mental health issues have just exploded, and I don't remember these kinds of things, or maybe wasn't aware of them when I was younger. So is your research that you're looking at, are you looking at root causes? Like, so I have read studies where, this generation tied to their phones and Instagram is increasing suicidal ideation in girls and all this kind of thing. So in terms of, I see you're looking at treatments. This but are we going backwards? You mentioned going upstream. So what has your upstream research discovered in terms of burgeoning root causes that are causing this explosion? My daughter is in her 20s, and it's like every single friend she has suffers from anxiety. How is that? But, you know.
Well, I have to say, we're not doing that in Bloomingdale Township, right? But there is a lot of research going on looking at it. I think two things that we're seeing right now are, number one, the pandemic, right? The pandemic has really been a trauma for everyone. And when any one of us, like I think all of us can admit, we have not been functioning optimally for 2 years, right? And we've all kind of gotten to the point where we're saying, well, I should be fine by now, right? But we're not. Like, we're all still not doing our best, functioning at our best. When we go through a trauma, the kinds of needs that we always have are really exacerbated, right? And so what we're seeing with youth is no different, right? They're just at a different developmental level than the rest of us adults, right, going through it. So I think what we're seeing right now, in huge part, is the trauma of the pandemic and people trying to come out of it with all the uncertainty that we're still living with. The other thing is something positive, a silver lining of the pandemic is that everybody started talking about mental health.
Yes.
Everybody started talking about mental health, and me publicly admitting in this group that I've not been at my best, right? I'm not doing so great some days. That's okay. That's commonplace. We all are like, yeah, me too, right? And so thinking about our own mental health in the same way that we think about any other aspect of our health, our dental care, and all that, I feel like the pandemic has reduced stigma to a certain extent. And so, your daughter's friends are all open about, their need for a therapist, right? So I think that's been a silver lining. Although I think that, the only way for us to help everybody is some kind of a public health model, because this is a public health issue at this point.
But you're right, there's been a whole lot more publicity about it. Newspapers, online, it's been wonderful.
Except for the waiting list.
Okay, Shannon, I'm going to turn it over to you now to talk about what you're doing about this.
Sure. Well, first I want to echo what Dawn and Brenda have said. So many great points, and so much of it is just the reality that we're seeing at my agency too. Just to give you a sense of volume, for my organization, Northeast DuPage Family and Youth Services, as was mentioned, we have 2 full-time social workers in the Glendale Heights Police Department, and then we're also working in the Bloomingdale Police Department. And so far, in the first quarter of 2022, we've already had 132 referrals just from the police department. And they run the gamut from a lot of domestics, suicide ideation, mental health crisis situations, and then also, things like food insecurity and homelessness and housing and shelter, legal issues, things that people are calling the police for, and they may not be a police matter, but they need help and they need connection to resources. And so that's really what we're providing. So we're not only providing counseling where it's needed and sort of, like Brenda was saying, sort of right-sizing the intervention to what the person needs. Not everybody that's going to come to our attention needs therapy, right? They may just need connection to resources. And so that's part of what our police social workers are doing, in addition to kind of the therapeutic models that we're implementing. So, if you annualize that, we're going to see well over 500 referrals just from the police department this year in Glendale Heights. And so, I think it speaks volumes about the way that the police department is approaching this. Again, we have 2 full-time people there. They're actually constructing a 3rd office for us right now. That's how much they're invested in this work. So that's very exciting. And it's exciting to see how well they have received us as mental health practitioners. It's not something that they're used to, and so they've just really embraced us, both in Glendale Heights and Bloomingdale. Bloomingdale, so it's been a great partnership. But the other thing that we're doing, and Brenda alluded to it, is the care coordination piece. And so we have one care coordinator position that's working part-time, funded by the 708 board. We've already worked with about 15 people in the township, and it's different than case management. So the care coordination piece is really that higher level piece for people who have sort of multiple needs and are navigating multiple systems. So they're not only maybe involved in substance abuse, or they might not only just have a mental health issue. They might be dealing with both of those things. Might have a dual diagnosis. They might also have criminal or juvenile justice involvement. They might also have legal issues going on, a domestic incident. They might also be homeless. They might also be food insecure. And so there's a whole host of things that are contributing to their poor mental health or their substance abuse. And so trying to sort all of those things out and figure out, well, what do we do first? What do we stabilize in order to be able to help this person and help their family? And it's all based on this idea of wraparound or systems of care, and that's sort of like academic speak for making sure that we're doing things on an individualized basis, making sure we're meeting people where they are, using their language, acknowledging their culture and what that means to them, and accessing resources that are going to support that and appreciate that. Making sure we're playing to their strengths and not just looking at their deficits, playing to their strengths. Everybody has a strength that they can access, and so making sure that we're really tapping into that. And the partnerships and the community-based aspect of the care coordination is really the critical piece. So Dawn mentioned it, Brenda mentioned it. There are so many resources in DuPage County. We all don't work together all the time. We all often work in silos. We're doing really good work, but we're doing it kind of on our own. And when we need something, we know who to go to, but not always. And so I think what we've really tried to build here is those relationships and those partnerships, and they're critical. Dawn mentioned working with Colleen and working with some other agencies to really mobilize in the aftermath of a crisis. So not only doing it in the aftermath of a crisis, but just on an ongoing daily basis to make our lives easier as therapists, as agency directors, so that we can do a war handoff to somebody. These people that are navigating these multiple systems and that are going to be participating in the care coordination model, we're actually working on one case right now where it's a 12-year-old boy. He's actually doing like 5 hours of therapy a week with 5 different therapists. And so it got brought to our attention that there's all these different players involved, and one therapist is saying one thing and the other is saying another thing, and they're not necessarily wrong, but nobody's talking to each other. And there's all these different extenuating circumstances that need to be sort of organized. And so we're not just telling a person, oh, you've got all of these issues going on here, make this appointment with this person, or go talk to this person, make this appointment. We have a care coordinator that's looking at everything that's going on and saying, okay, let's prioritize, let's back things up, let's make it easy for you to navigate all of this. We know the systems, we know the players. We don't expect you to know that. It's complicated. It's complicated even for providers to figure it out. So, we're expecting people to kind of know where to go, which is where the resource guides come into play and the awareness building and all of that. So those are all really good things that I think are coming out of this. Again, our wait list, we have 90 people on our wait list. 61 of those are under the age of 18. And some of them have been waiting for services since December. And we call them every week because we want to make sure, are you still interested? Have you found services? And 95% are yes, I want to wait, we need services. But anybody else you call also has a wait list. So they're willing to wait. And these are typically low income families who may or may not have insurance. If they have insurance, their co-pays might be a barrier. So they can't just pick up their insurance card and go anywhere. Or transportation is a barrier, language is a barrier. We have 4 Spanish-speaking therapists that are able to address that. So we really, again, it's the access issue that we're really trying to work on too. So all of those things combined is really kind of, I think, culminating in some really good work. And we're learning a lot. And I just think In terms of the township, again, the partnerships and the collaboration is really the most important because there are a lot of resources in this township and in DuPage County. We just have to know the best of each other and how to help people access the best of all of them.